you. All right, so this is my month of visits. So again, I only do private practice part-time. I did 19 visits, which feels a little high to me for the month, but um, you'll see how it breaks down. Okay, so my first visit for the month was um, Mom J and baby boy. I actually had almost all boys this month. So this was a second time mom. She delivered at 39 weeks. She breastfed her first baby for 12 months, but she exclusively pumped because she got off to a rough start. I actually saw her with her first baby. She went back to work at 12 weeks. And, other than having trouble with breastfeeding in the beginning, the pumping went well, no supply problems. So she didn't call me in the beginning with this baby, the second baby. She didn't call me till 2 months because she was worried that the baby wasn't getting enough because he feeds so quickly, which is typical with a multip. His birth weight was 8 pounds. His weight today was 5,700 grams. He transferred 90 mLs in like 6 minutes. So he's doing great. This was an easy visit, and I told her to follow up as needed. The next visit, so same day, I saw a different J and baby boy. She was a G1, P1, vaginal delivery at 39 weeks. I didn't see her. Oh, this was a repeat visit. So I saw her in the very beginning when she delivered, and this baby was breastfeeding great. Mom is a physician. She went back to work, and then they went to India for 1 month. And during that 1 month, she was exclusively breastfeeding. And when she went back to the pediatrician after the visit, the baby's weight gain had slowed down. He also would no longer take bottles or solids. He transferred milk okay. He transferred 75 mLs from, I think, just one breast at the visit, but he really needed a referral to speech at this point because he was no longer taking solids and not taking bottles anymore. So that's what I did with that one. And I referred her to a great speech pathologist that I actually interviewed about baby-led weaning on the podcast. So if you haven't listened to that one, I recommend it. But anyway, that was that one. The next visit, same day. It's not uncommon to have like three in one day and then have nothing else for the rest of the week, which is great because I get a lot done in one day and then I have the rest of the week for other things. So this was a prenatal visit with I. She's a 33-year-old G1 P1. She was 35 weeks at this visit. She had IVF for unexplained infertility. She was on thyroid medication, no GDM. So she's an OB also. The plan was for her to be induced at 37 weeks for hypertension and poor placental perfusion. They said the baby was small. And I did the prenatal visit. I taught her about antenatal hand expression, which she actually already knew because they do that at her practice. And then told her to call me when the baby delivers. All right. Next day, I saw A and baby boy. This was a repeat visit with a 41-year-old G1 P1. She had a history of infertility, multiple rounds of IVF. This was the first pregnancy. Possible PCOS based on hormonal on the labs, and she had a connective tissue disorder, which is relevant. This mom had been breastfeeding well, but she said suddenly it seemed like baby only went to nurse one breast, and then he wanted to take a break and nurse an hour later, and it was getting frustrating. She was also really the primary reason I was there is for pain with pumping. And maybe Diana can share a little bit more about this later if she'd like to. But this mom, because she had the connective tissue disorder, we really struggled to find a flange that was comfortable for her. I ended up giving her I had some samples of the pump and pals, which kind of have a long angled neck. And she was going to try those and then order them if that was what worked for her. So baby transferred milk great. Everything is going well except for the pain with the pumping. So she is going to follow up with me as needed. All right, the next visit is with Jay and baby boy. This was a 27-year-old G1P1 emergent C-section at 36 and 1 for preeclampsia. This mom had so many medical problems. She coded in the OR. She ended up in the ICU for 2 days. She had obesity, sleep apnea, irregular periods, IGT. So her baby went to the nursery and she was in the ICU. Fortunately, she delivered at a hospital that had donor milk. So baby got all donor milk in the hospital. And once she was out of the ICU and into postpartum, she started pumping. The baby would latch, but made sense. He got frustrated very easily because there really wasn't much milk available. Interestingly, in the state of Illinois, I think it was January of 2020, the law was passed that covered donor milk for certain health conditions, for insurance, for Medicaid and private health insurance. And somehow this mom was able to get donor milk covered at 75% for her baby. So when I saw her, the baby was 1 month old and she was still getting donor milk from the milk bank covered almost entirely by insurance, which is awesome. It's really sort of unheard of. Anyway, the baby weighed 3865 grams, no transfer. We talked about pumping, we talked about all of the things, but this was really just a referral to breastfeeding medicine, because we really couldn't make much of a difference. She had already been doing some pumping and it wasn't making a difference. The baby really didn't transfer. He got frustrated within like 10 seconds of getting to the breast. So the best recommendation here was just to refer to breastfeeding medicine. All right, so a couple days later, I saw G and baby boy, and this was visit number 1 with them. I see her a few times this month. So this is a 38-year-old G1P1. You can see a trend here. I'm seeing a lot of primips. She had a C-section at 37 weeks for hypertension. She did have 1,000 milliliter blood loss after delivery, and she got IV iron. She has a lot of health conditions that were problematic: obesity, non-alcoholic fatty liver disease, a history of eating disorder, anxiety, depression, a clotting disorder with medications for all of these things. No thyroid and no infertility and no gestational diabetes, which was great. She was doing a lot of formula in the hospital because the baby really wasn't latching well. As we see in the hospital, these babies are generally pretty sleepy, disorganized. C-section babies tend to be more spitty. So when I saw her, I believe the baby was 5 days old when I saw her, and we had been doing lots of formula. We decided to prioritize the latch and the positioning and then protect supply because she really wasn't pumping and there really wasn't good stimulation. So I wanted to see if we could achieve a full supply. Her baby did transfer 45 mLs, but they feed the baby a lot of formula and he wasn't content with 45 mLs. So we did a triple feeding plan until the next visit. So for those of you that just came into this meeting, I am going through all the visits I did in February. Just a high level, not going really deep into these. I can certainly answer any questions that you have. But the objective here is to kind of show you what you would expect in private practice, the kind of visits that you might see, the referrals you might make. And then the last slide, I'm going to show you how much money I made for the month doing these visits. And I do private practice part-time only. All right. The next visit I did a few days later with Mom M and baby boy. This was our first visit. I do see her again. This mom had no history of thyroid, no infertility. She had a vaginal adult birth at term. She was having trouble latching in the hospital. They were having her do hand expressing and syringe feeding. She actually went home exclusively breastfeeding, but on day of life 3 at home, baby was freaking out because there was really not much milk available and her milk hadn't come in yet. So she was doing attempts followed by formula. She was tried to pump, but she had a Spectra with the standard flanges and she had wearables and nothing was really working great and it was giving her pain. Her milk came in around day 4. So I saw her at 9 days postpartum. The baby was not quite back to birth weight. He transferred about 35 mLs. So because of the formula, because there wasn't good stimulation leading up to day 9, we did triple feeding until the next visit. All right. So the same day I saw S and baby boy. This was visit number 1 with her. She was a G3P2 vaginal delivery at term. She had a precipitous labor. She nursed her first baby for 6 weeks. She had trouble with latch and slow supply, which was really sort of unexplained because it didn't seem like she had any risk factors for low supply. So we don't really know why that happened. With this pregnancy or with this delivery, she's doing this Ayurvedic diet that gets delivered, this food that's pre-made delivered to her house for 30 days. She's doing this as a sort of protective mechanism, she thinks, to help with her supply. I don't think it's going to hurt by any means. One of the interesting things, though, is that diet includes sunflower lecithin for her to take every day, which I explained to her we don't have any evidence that it increases your milk supply, and the evidence around the use for plugs is really poor. So we talked about it. I told her it probably wasn't going to hurt anything if she wanted to keep taking it and follow that diet. So her pain, she had latch pain initially. She started giving formula. She was doing a little pumping here and there. So when I saw her, baby was 11 days old. He transferred 35 mLs at the breast, so the supply's down a little bit. He's used to getting more milk than that, so we're doing a little bit of a triple feeding plan until the next visit. The next day, I saw Elle and baby boy. This was a 35-year-old G5P2. She had had 3 miscarriages. This baby was born at term, vaginal delivery, no risk factors. She nursed her first one for 4 months with no problems. She said she was a great nurser. I just didn't really trust it. So she wants to go longer this time around. Baby was nursing good in the hospital. She gave some formula at home while she was waiting on her milk to come in. She started pumping on day 5 because her breasts were really full. And then she started experiencing some pain with latch, which is why she called me. So she was having poor latching pain, and then it felt like the baby wasn't really transferring well, which was because the baby was getting on really shallow. So she was doing a little bit of everything, but wasn't super successful at it. So when I saw her, baby was 9 days old. Baby, once we fixed the position in the latch, which was like a really small tweak, baby transferred awesome. I taught her how to do hands-on breastfeeding, so compression. I did give her the correct size flanges, and she said that pumping was more comfortable. So we talked about really just pumping to replace any missed breastfeedings, and that if she can get the baby to nurse like he did at the visit, that we're good, and she can just follow up with me as she needs. All right. The next visit I saw was R and baby girl. I think this was the first girl I saw all month. This is a 35-year-old vaginal at term. She did have excessive blood loss, but we weren't sure how much it was at the delivery. She did get IV iron. She nursed her first baby for 16 months with no problems. I helped her with her first baby. And this baby was doing great until 1 week ago. And the baby, when I saw her, this kid was 17 weeks old, so just over 4 months. Mom is back at work. Baby gets bottles when she's working, which is 3 days a week, and baby does okay with the bottles, but she doesn't really love breastfeeding. The baby has never really loved breastfeeding, but mom was sick and she thinks that maybe her supply decreased when she was sick and that maybe that's why the baby was so fussy. So we were able to get the baby to latch on, and she transferred 45, which it's not the best. I mean, it probably should have been bigger than that, but She was so fussy. I mean, mom had to use the pump to get the letdown started before the baby would even latch on. And then she latched on and she sucked pretty actively for maybe 5 minutes. And then she just came off crying. And mom had to give her the pacifier and bounce around for a little bit longer. And then we were able to get her to nurse for maybe 2 or 3 more minutes. But that was it. So mom was going to work on supply with pumping, adding some extra pumping. And we were going to try. I remember one of my kids going through a period of time like this, and this baby seems to fit some of the things that I've read in the literature about babies maybe being like overstimulated. So I talked to her about maybe trying to go into a quiet, dark room and laying down with her feed and see if that would help. She may be kind of overstimulated. I didn't want to say anything like this baby may be neuroatypical because that's outside of my scope, but it kind of felt like some of the case studies that I've seen around that. So I just kind of gave her that guidance and then told her to follow up with me and let me know how things are going. Okay, now I'm going to see S and baby boy. This is our second visit. So remember at the last visit, he's 9 days old. She was doing he took 35 at the breast, and I had her do a little bit of a triple feeding plan. Really, the most important thing was the consistency in pumping. She was breastfeeding and supplementing, but she wasn't pumping consistently. So this time she was pumping consistently. I gave her, I want to say it was 15 millimeter flanges, which she said was really comfortable. And this was an increase. Baby transferred 40 this time. It was only 35 last time. So that's a good sign. And so we're moving in the right direction. I wanted to follow up with her in a few days to see how things are going. All right, the next day we're going to see G and baby boy again. So now he's 15 days old. Mom had been really consistent with the pumping, collecting 2.5 to 3 ounces per session, which is great. Remember, this is the mom that had all of the health issues, and except the hormone things weren't really problematic, except for the obesity, which could be a little bit problematic. But I really was hoping that we would be able to get to a full supply. So this is great output. I mean, she's doing a great job here. Baby transferred 45 mLs. So we're moving in the right direction. It's not perfect yet, but she definitely has seen a reduction in the amount of supplement she's had to give the baby. So this was really a good sign. All right, the next visit, I saw M and baby boy again, second visit. So he is 12 days old here. This is the one that she was doing a lot of formula. She was hand expressing in the hospital, doing a lot of formula, trying all different pumps and not having good success. So I gave her the right flanges. She was pumping really consistently with her Spectra, getting decent output. Her baby transferred 40 mLs at the breast. So we're moving in the right direction. We're not done yet. So I said, we'll continue this and follow up in 3 days. Okay, so this I is the one I did the prenatal visit with. Her baby was born. The baby was born following induction at 37 and 2. Unfortunately, she did have a postpartum hemorrhage immediately after delivery. She lost 1,300 mLs. They gave her an IV iron transfusion, and due to the postpartum hemorrhage, she did have a little bit of a delay in the milk coming in. It came in on day 4. Because her baby was little, the baby was 5'8" at delivery and 37 weeks. Her sugars were fine, but I think that the provider was a little overcautious. They really want her to supplement with formula until the baby's back to birth weight. So she was doing some breastfeeding, well, putting the baby abreast at every feeding. The pediatrician actually told her, do 5, 5, and 5. And she wanted to get my thoughts on that. So I said, I don't love all the switching. I would rather you just keep the baby on one breast as long as she's active and then supplement afterwards. So baby nursed great. You can see here when I did a weighted feed with her, she transferred 35 mLs. She was 5 days old. I mean, this baby's,
Margaret,
yeah.
what was the 5, 5, and 5?
The pediatrician told the mom to nurse the baby only 5 minutes on one side, then switch 5 minutes to the other, and then switch back 5 minutes to the first breast again, which doesn't really make any sense to me. That baby's going to just get frustrated and shut down. So I said, just stick to one breast for 10 minutes and then, or as long as the baby's active. And we really focus on what active looks like versus not active. Um, and follow up in 3 days. So this was, oh, and also doing some pumping afterwards, just to make sure that we're protecting the supply because baby isn't able to breastfeed on both breasts at this moment. All right, the next visit I saw H and baby girl. This was a 34-year-old G1P1 vaginal delivery at term. She had a prolonged stage 2, which means she pushed for a really long time, more than 4 hours. No thyroid, no infertility, no gestational diabetes. Because she pushed for so long, this baby was really spitty and sleepy in the hospital. She went home shortly after 24 hours, but on day 2 of life, the baby was really fussy and had no diaper output for 24 hours. So the pediatrician had them give appropriate volume, about 15 mLs of formula at every feeding, just for 24 hours. And then her milk came in on day 3 and she stopped giving formula. I saw her on day 5. The baby nursed beautifully, transferred 50 mLs, did amazing. So mom was not interested in doing any pumping, wasn't supplementing anymore. So the plan was for me just to follow up with them in a week and we could talk about next steps with when to introduce the bottle consistently and thinking about pumping for going back to work. Okay, the next visit is with S and baby boy. This is our 3rd visit. So now he's almost 3 weeks. The last 2 days, he was clustering sort of constantly. Mom's pump output is up to 2 ounces, which is great. That's an improvement. And baby is transferred 45 mLs at the breast, which is an increase from the last feeding. Her pediatrician's happy with the baby's weight. Mom is happy to just pump and supplement as needed. So this was a sort of follow-up as needed. The other sort of problematic thing with her, the type of insurance she has limited us to 3 visits. So I'm happy to see her again and we can work on a cash pay thing, but we were able to kind of get to a good place in 3 visits with her. All right, the next visit is with N and baby girl. So this is a 37-year-old G2P1. She had a C-section at 39 and 2 for face presentation. This is the other trend this month. This mom also lost 1,000 milliliters at delivery. She did get IV iron. 3 of them got IV iron this month. No thyroid. She had IVF for unexplained infertility. Mom said she thought it was a dad issue, and no gestational diabetes. Interestingly, this mom is also an OB. She was doing lots of attempts and formula in the hospital, but baby would get frustrated easily at the breast. I saw her on day 5. The milk had not come in yet. So I think that related to the age and the C-section and the blood loss, her delay in lactogenesis too was not super surprising to me. We tried to breastfeed the baby, but the baby got so frustrated and would not suck. So our goal was to work on supply only, to help make sure her body knows, yes, we want all this milk. And I was going to follow up with her in 2 days. All right, the next visit is with G and baby boy. This is visit number 2. He's 3 weeks old. Unfortunately, in the last few days, he's been clustering from 8P to 8A. So during that time, they started supplementing him a little bit during that period. Mom really hadn't been pumping at all since I saw her last, even when skipping feeds. Oh, so something interesting that happened between this visit and the last visit. Mom got readmitted to the hospital for 36 hours because she had a incision site infection. So they sent her home with a line and a wound vac, and home health is coming to her house every day to give her IV antibiotics and address the wound vac. So when the home health nurse would come, the dad would just supplement the baby and she wasn't pumping. So I talked about how we need to do something every 3 hours. So if you're skipping the feeding, let's maybe pump a few minutes before the home health nurse comes so we can help protect that message to your brain. Her pediatrician was a little bit worried that this baby was gaining a little bit slowly and wanted her to supplement about 6 ounces total in 24 hours, which they were, some days they'd give like 4 ounces, some days they'd give like 6 ounces. So we just landed on 6 ounces, and I'm going to follow up with them in 1 week to see how they're doing. All right. And then I and baby G. This is visit number 3, but really visit number 2 with the baby. Baby is 8 days old here, breastfeeding 1 side per feed, following with 1 ounce express breast milk. Mom is collecting 2.5 ounces after every breastfeeding, so this is great. We know her supply is coming in with abundance. Baby transferred 55 mLs at the breast, did beautifully. The plan is to continue doing this until the next visit, because at the next visit, we would expect the baby to be back at birth weight. And spoiler alert, I saw her today. That baby transferred 85 over birth weight, doing great. All right, so that was 19 visits. So I did 19 visits. All of these were TLN visits, so that means that it's a set reimbursement rate. Week 1, I did 4 visits. Week 2, I did 2 visits. Week 3, I did 7 visits. And week 4, I did 6 visits. I did a total of 9 initial visits at $200 each. I did a total of 10 follow-up visits at $175 each. So my total reimbursement for these 19 visits was $35.50. All right. I'm going to open it up for questions now. Any questions about the cases or the reimbursement or any of that?
Were these all TLN ones?
Yeah, they were all TL1. She's ready for you.
Just going to the
Yeah. Sorry about that. Yeah, they were all TLN. Sometimes I'll have wildflower. Sometimes I'll have cash patients. Rarely cash patients. But these were all TLN, which, if you don't know the way that it works with TLN, if you submit your chart, I want to say by Wednesday of the week. I'm not really sure. I don't really know. I try to chart them the same day or the next day and submit them, but they will pay you within 1 week. So it's guarantee. It's very easy. So I'm not one to complain a lot about TLN. I know there are others out there that do, but I don't have a lot to complain about. Jennifer.
For hemorrhage patients, do moms do better when they hemorrhage and then receive like iron versus moms who hemorrhage but it's not enough that they have or they're eligible to receive iron?
Yeah, really good question. So there's 2 primary things that we are worried about with the hemorrhage. One is if there's a significant blood loss, it can affect the pituitary gland. And, you need to know this for the exam. You need to be familiar with Sheehan syndrome. So if there's a significant blood loss, pituitary necrosis can happen, which can impact the pituitary gland, and the milk may never come in. In reality, you'll probably never actually see that. What we know from the research is that most of the time, Sheehan syndrome is diagnosed many, many years later. However, you should know it for the exam. So for moms that have a postpartum hemorrhage, if they get IV fluids immediately and they push volumes to keep their blood pressure stable, there's less of a risk of that necrosis happening to the pituitary gland. The other thing that we're worried about with a big hemorrhage like that is the effect on the hemoglobin, because we know that when moms have a low hemoglobin, that affects milk production. So if they get IV iron, or if the hemoglobin is low enough, or whatever the criteria is, if the hemorrhage amount is big enough and the hemoglobin, I don't know what the protocol says, but sometimes they get IV iron, sometimes they get transfused. But those things can help to get the rebound. So I think in the 2 provider moms, the 2 OBs that had the hemorrhage and they both got IV iron, they knew their lab values. So I know that one of the moms started at 11 and went down to 8, but then they did a rebound and saw that she came back up to 9. So that's good. That's an improvement. And the other mom, I want to say it was around the same range. That really can make a difference in helping to protect the milk supply.
Okay, so then would you say that for moms who, so it's not to the point of Sheehan syndrome, but they do have like a significant blood loss and they do have to get transfused for iron. Would you say like that's still like for the mom it's better than moms who have a lesser blood loss, but then they don't meet the criteria to get these?
Yeah, you know what I have seen in moms? I mean, let me just clarify. It's outside of our scope to recommend that this mom get an iron transfusion. That would be outside of our scope. But we could say, please make sure you're taking your prenatal vitamin with iron. That's important. But what I have seen for moms that don't meet the criteria for IV iron infusion, most of the time those providers just prescribe oral iron. So they're protecting it in some way. I think it's just about how much they're affected to whether or not they're going to get IV iron or not.
Got it. All right.
Okay.
Thank you.
Yeah, of course. Gina.
Going back to the TLN stuff, are
Yeah.
you allowed to do TLN and wildflower
Yes,
together?
you are. Yes.
Okay.
And in California, what I understand is that the non-compete for TLN isn't legal. So you can do all of them in California, from what I understand from other people.
Well, that's great.
Yeah. So the reason that I do wildflower also, though, is because wildflower only does Cigna. TLN no longer does Cigna. So
Got it.
it's not exactly the same thing.
So wildflower only does Cigna?
Mm-hmm.
Oh, okay. I had
Yeah.
no idea.
Yeah. So the way that it works with TLN is they will give you a unique URL, and you can put that on your website, or you can send it to patients that reach out to you. Sometimes people will just go to my website and click on the verify insurance link, and I will see an email come through that says that they were declined, but it doesn't really tell me what insurance they had. If I go look in the TLN portal and see that it said that they were Cigna, I'll just email them and say, actually, you need to use this link instead.
Got it.
Yeah.
Okay.
Okay, cool. Carly.
Hi.
Hi.
Quick question back to Sheehan syndrome. So
Yeah.
if you've got a mom that's had a significant amount of blood loss, but things are going really well, would you be educating her on that anyways to keep her eye on it for future? Would you bring her attention to Sheehan syndrome, or not really? You don't want to freak her out?
If her milk is in and things are going well, she doesn't have it. It's an irreversible necrosis of the pituitary gland. And what
There would be symptoms straight away.
Well, yes, but the research says that it's often hard for us to pinpoint that this lactation failure is a direct result of Sheehan syndrome unless they do imaging to see if the pituitary is damaged. And that doesn't happen in most cases. What the research says is that most of the time this shows up 10 years down the road when women are having all these hormonal problems, or they're never able to get pregnant again, and they don't really understand why. And I actually confirmed it with one of my OB patients because I said, do you ever see this in practice? And she said, no, definitely not. So the thing about, I think it's always a good idea to provide anticipatory guidance. With a postpartum hemorrhage, our normal expectation is that your milk is going to come in somewhere between day 3 and day 5. But if it's after day 5, that wouldn't be out of the realm of normal with a postpartum hemorrhage. So if you get to day 5 and that hasn't happened, reach out to me so we can make sure that we're helping to protect your ability to make milk for when the milk does come in. Does that help?
Yeah, definitely. Thank you.
But all you people about to take the test, you need to know there'll be one question guarantee on the exam about Sheehan syndrome. It'll say something like, this mom had a postpartum hemorrhage after delivery. what is the thing that you're most worried about, as far as the supply or something
Yeah.
like that? And the answer will be Shan syndrome. Make sense? All right, Tori.
Back to the TLN
Mhm.
thing. Did these clients all find you through TLN, or did you just bill them through TLN, but they found you some other way?
That's a great question. Let me look at the patients, and I'll tell you. I know both of the OBs, those two patients, were referred to me by other OBs that I took care of. So those are two referrals. So when they reached out to me, I just sent them the link to verify their insurance. I actually think maybe only two of these were referrals from TLN directly. I go through waves. I generally get a lot of referrals from TLN, but sometimes I don't. I think two of these were referrals directly from TLN. I know that a few of them were, like I said, two of them were patients that I had seen with their first babies. And then I think the rest of them were either they found me via Google or referrals from other people.
Okay. And is this like a pretty typical month for you in terms of like the volume of clients, or?
I really would love, my ideal would be to see like do 3 visits a week. That would be my ideal. So I'd say this is probably a little heavier than I would prefer. I do have a contractor though that I'd love to, she has limited availability. I give her as many visits as I can. So and I didn't even count her visits. So I did make a percentage off of her visits as well. But I would rather do 3 visits a week if it were up to me.
Okay.
Yeah. But you can see, if we look back at the last slide, week 1 I did 4 visits, week 2 I did 2 visits, and then week 3 and 4 I did 6 and 7 visits. So if you wanted to do, let's say you wanted to do 3 visits twice a week, that would be 24 visits. So it would be slightly more than what I did, and you could make, $4,500 or whatever the math ends up being. So I think you guys could do the math and kind of figure out what that looks like. And obviously the reimbursement rate's higher for twins. I didn't have any twins this month, so I didn't put that rate in there, but this is the standard reimbursement rate.